Assalamu alaikum. How are you guys? And I'm thankful to you guys that you're listening to my videos. You do comment, give a feedback. Jazakallah khair. In this video, I'll be discussing on menstrual irregularities challenge which many females face. That is irregular periods. And it's true that we all are facing issues in order to visit healthcare centers, surgeries, hospitals, clinics, because these days it's scary due to corona, due to COVID-19. So for complaints, such complaints, people are finding teleclinics, are taking help from doctors all over, from the surroundings, so that, and even doctors are so much, I mean, they're packed up with their duties, and it's really challenging all over for everyone. So that's the reason why I plan to make a video for you guys, so that you can recognize, categorize, understand what is actually going on regarding your menstrual cycle period. Now, first of all, you need to know what's a normal period duration. Normally, it's 2 to 7 days. That's also given. The time period is also given in NHS website. 2 to 7 with an average of 5 days. Now, and the interval between one menstrual cycle flow to the other varies from a person to another person. It can be a shorter one up to 28 days, this interval between two flows, 21 days. Or a longer duration can be up to 38 to 40 days. So that is a longer interval between one flow to the other flow, and these are all categorized as normal cycles. Now, in order to understand your flow, your menses is in irregular periods, is categorized into irregular periods, you have to understand three indicators. You have to check out for three indicators. Number one, the duration, the 7 duration is you are facing an abnormal duration, that is more than 7 or less than 2 days of your cycle, of your flow. Number one. Number two, either the interval between the two menstrual cycle, menstrual flow periods is less than 21, that is coming more frequent, or it's more than 40 days, that is it's coming up less frequent. So that means you haven't you and eh, the third is the quantity. The quantity might be very scanty or might be heavy. So heavy flow is also indicated by changing the tampon or the pad every 1 hour or 2 hour, or having some clots. So these are something abnormal. It's not normal. Three indicators, three pointers to label your menstrual flow to be irregular periods. Now, what are the causes? The commonest causes of irregular periods are either at the puberty age, which is from 11 to 14 years. It can be as early as 8, 9, or 10. That's also considered as normal. But the puberty time period is almost 4 years, 11 to 14. If the menarche or the first flow occurs from 11 to 14, that's all normal. Even less than 11, even 8, 9, 10 is considered to be normal, but less than 8 should be considered to for an expert opinion. You need to go to your GP. You need to consult that. And if it's more than 14 years, your daughter is not having a menstrual flow, so you need to have an opinion from the expert, your GP. Now comes that the females who are having an age of 45 to 55, then they'll be having their menopausal time period. Perimenopausal symptoms starts occurring from 40 years, and it occurs from 4 to 8 years of age. And 45 to 55, normally there is a complete stoppage of menstrual flow. Prior to that, there is perimenopausal irregular periods, then the ladies start experiencing irregular periods from the age of 40 and takes about 4 to 8 years. But it is associated with other symptoms of menopause, includes hot flashes, includes decreased sleep at the night time, increased mood swings, irritability in the mood, and also there is night sweats. These are the symptoms associated with irregular periods, and again age. That shows that the person is experiencing or is passing through perimenopausal perimenopausal cause of irregular periods. Now, then you'll come to the cause of extreme weight loss, malnourished. Extreme weight loss can also lead to irregular periods or eating disorders. That can also lead to irregular periods. Now, the causes of excessive or sudden weight loss might, there are a lot of causes. It can be a cancer patient, a patient with chemotherapy, a patient who has undergone a surgery of abdomen like surgery of the stomach or the intestine, or I mean such surgeries can lead to excessive weight loss. So, such females can also experience irregular periods. Why? Because less calories are taken or less calories are absorbed, which because the body needs calories, adequate calories to synthesize hormones that are important for ovulation, that is the luteinizing hormone. Then and also hormones like estrogen and progesterone, which monitor the whole menstrual cycle, follicle stimulating hormone and luteinizing all needs calories, adequate calories. So a BMI of less than 18.5 is important, is marked as a BMI of under or malnourished. And if the malnourished BMI person has stopped periods with fatigue, headache, hair loss, should be considered to be irregular periods due to the weight loss and should be treated accordingly. And again, eating disorder also can have same eating disorder, also insomnia. Models of these days, they try to maintain their figure so much that they don't have anything in their diet. So that can also lead to irregular periods. Then the fifth reason, a cause, is excessive weight gain, that is obesity. Obesity with a BMI of greater than 32 or 30 even is considered to be obese person, and the BMI calculated by the body weight and the height is important to. It's an indicator of obesity. Obesity also, I mean. Disrupt the hormones in the body. There is a fluctuation in serum insulin and the hormones regulating the menstrual cycle. Hormone like polycystic ovarian syndrome leads, it's also related to obesity, and there is a sign of obesity in polycystic ovarian syndrome. Hypothyroidism also have obesity, and it can also lead to irregular hormones, which can also cause irregular periods. Now, those who are obsessed with intense exercise, I would advise them, please discuss with your coaches, because intense or athletic females can also have irregular periods. So if but this is reversible if their intensity of exercise or activity is changed or it's monitored, so their irregular periods will be, it will come back to the normal. So there is an advice to those who are habitual of intense activity. They can reduce their intensity. Now, stress, which is very important, and these days everybody is facing stress. Kids are facing stress, girls are facing stress, Stress can be from their schools, stress can be from their office, their jobs, financial stress, their stress from the relationship at home. So stress, it's itself a very important point, because in the brain we have hormones that regulate these hormones, menstrual cycle hormones. The hormones from the pituitary gland regulate the hormones for the menstrual cycle. So all gets disrupted, and you need to monitor your. And I mean, this disruption in the hormones leads to irregular periods. So you need to work on your stress. Okay. And then we have early pregnancy. In early pregnancy, it can also have spotting, and but the sign and symptoms of early pregnancy can help out to exclude out an irregular periods due to pregnancy, which can be morning sickness, can be nausea, can be dizziness, and increased sensitivity to smell, and breast tingling, fatigue, and which can be excluded out by a pregnancy strip test or beta SCG test. And this is so pregnant and breastfeeding mothers. So that we have another cause of breastfeeding mothers. In breastfeeding mothers, the hormone prolactin is in a higher quantity in our serum, which actually suppresses the estrogen and progesterone, and it causes irregular periods. This is a formula from nature, so it leads to irregular periods. And then when the mother, I mean, stops breastfeeding, her periods comes normal, and that is a blessing from God, that you don't conceive during. It's a natural contraception that you don't conceive when you are breastfeeding your baby. So that's a blessing from the nature. And it's a time period when the mother is also regaining the health of her own health, so that she can nurture her baby. So we have discussed almost 8 causes now, sorry, 9 causes. Now we have another cause, that is a contraception taken as pills, contraceptive pills, which again contains hormones, estrogen, progesterone, hormones. Again, it's altered the whole system hormones. So for those who go for umrah, for those who go for hajj, for those who want to have some fasting, those ladies basically ask a lot of questions of taking pills also, these hormone pills, and in order to stop their cycles. And those females who don't want to get pregnant, they're also taking contraception pills. They all can face irregular periods. And then the IUDs, intrauterine devices, which are coils. There are two type of coils: copper coils and hormonal coils. So basically, these coils can also lead to heavy bleeding. So these are all the causes of irregular periods. Now we have medications. Some females who are having some medications for some other comorbids, so can lead to irregular periods. Like for example, people are taking blood thinners like Asgard, aspirin. They can also have irregular periods. Females who are having epileptic medications, treatment for their epilepsy, can also face irregular periods. Females who are having medication for thyroid, hypothyroidism, or the hyper, so they can also face irregular periods. Patients or females who are depressive, are having antidepressants, can also face irregular periods. And females who are having chemotherapy, because chemotherapy can cause irregular periods, can stop the ovarian function. So it's important that after chemotherapy, the ovarian status is assessed, so that they can have the normal periods. And then those females who are in the perimenopausal phase, they're having symptoms of their perimenopausal phase. They're also given hormonal pills, that is the HRT treatment. hormone replacement treatment that can also cause irregular bleeding, spotting. That commonly causes irregular periods. And it's important to know that the females who have uh, a who are experiencing of no menstrual flow before the age of 40 for a period of greater than 3 months or 6 or 1 year, they need to be assessed for premature ovarian failure. It's important because that is basically shows that the ovaries have stopped functioning prematurely before the menopause. So the FSH is needed to be assessed. That is normally at FSH at menopause is up to 40, and if that occurs before this age of 40 years, so that's 40-40, you can understand that can be diagnosed as a premature ovarian failure. And ultrasound of the ovaries can also can also assess the ovarian function, if there are follicles over there or not, and what's the status of the follicles in the ovaries. Now, other medical or pathological reasons of irregular periods are the common ones I'll be listing first, and then I'll be making videos on each and every pathological reason of irregular periods. First of all, the most common cause is polycystic ovarian syndrome. Polycystic ovarian syndrome is such a common cause of irregular period, and these ladies also struggle a lot to get pregnant. This is a pathology in the ovaries, that cysts develop in the ovaries. The cysts compress the normal follicles, can also deteriorate the health of the normal follicles in the ovaries. So we'll discuss it in a separate video. Polycystic ovarian syndrome. Number two is uterine fibroids. Uterine fibroids, these are endometrial masses, whatever the sizes are, can be as small or minute or as bigger, and can be bigger even, as big as a baby itself. So these are also the reasons of irregular menstrual cycle, irregular menstrual flow, and it can lead to heavy flows. Heavy flows can lead to clots in the flow. So we can discuss this in a separate video also, because it's entirely a big topic. Then we have thyroid problems. Hypothyroidism and hyperthyroidism can also lead to irregular periods, and these ladies also struggle a lot for getting pregnant. Endometriosis is also entirely a medical issue. Endometriosis is also an issue in which the endometrial lining of the uterus, basically it gets deposited in the abdominal cavity, and then at the menstrual flow days they have a heavy flow, and with abdominal pain, much abdominal pain. So these ladies also face a lot of conceiving problems, pregnancy. They struggle for that. So we'll be discussing these in different videos. Now the important thing is you need to recognize when you need to visit your GP, your doctor, your expert. Number one, that the duration of the flow is more than 7 days. It's heavy or scanty. Heavy if the person, you are experiencing clots, you're changing tampons and pads each hour or each every 2 hour with heavy flow, or the cycle is more frequent, that is less than 21 you're having a second flow, then less than 21 days you have a second, more frequent periods, and or more free or less frequent, that is you're having your flow after 2 months or 3 months, and then you have to visit your GP. Or you are not having any menstrual flow more than 3 months, then you have to visit your doctor, you have to visit your GP. Or if there's a discharge, vaginal discharge, that is associated with itchiness or a bad odor, or it's it irritates you. It's associated with fever, so it's needed to be assessed. It's needed to be examined. Your there should be some examination of vagina, and those females who are having irregular periods and are struggling to be pregnant need to be assessed completely. So, in assessment, obviously, after a medical history, hormones will be assessed, will be tested, and a medical examination, physical examination with associated with ultrasonography examination is important. Depends from person to person, from case to case. So, I think this video will be helpful for those for those who are facing irregular periods, or you guys. I hope it's going to help you out, and then I'll be coming up with more videos with different pathological reasons. Thank you.